Do you feel anxious before surgery and anesthesia? It's a question that resonates with many of us. The anticipation of an operation, the unfamiliarity of anesthetic procedures, the worries about what comes next, these are all common sources of anxiety. And it's perfectly normal. After all, our bodies and minds are wired to respond to potential threats, and surgery can certainly seem like one. But here's the good news. This anxiety doesn't have to be a foregone conclusion. It can be managed. It can be reduced. And that's what we're here to discuss today. We're going to introduce you to a comprehensive solution that addresses anxiety before surgery and anesthesia. A solution that's backed by science and designed to empower you with knowledge, strategies, and resources. So take a deep breath and get ready to turn the page on preoperative anxiety. Stay tuned as we walk you through a comprehensive solution that can help you manage and reduce your anxiety before surgery and anesthesia. First, it's crucial to understand why we feel anxious before surgery and anesthesia. Fear is a natural human response to situations that we perceive as threatening or unfamiliar. When faced with surgery or anesthesia, these feelings of fear and anxiety can become intensified. One of the primary reasons we may feel this way is due to the fear of the unknown. We may not know what to expect during the procedure or how we will feel afterwards. This uncertainty can lead to feelings of unease and worry. Another common fear is the fear of pain. Despite advancements in medical technology and anesthesia techniques, the thought of experiencing pain during or after surgery can still be a significant source of anxiety for many. There's also the fear of complications, which can range from minor side effects to more severe, life-threatening conditions. While complications are rare, they are a possibility, and even the smallest chance can cause worry. Moreover, the fear of losing control can amplify anxiety. Under anesthesia, you're entrusting your well-being to a team of professionals. While this is standard procedure, the idea of not being in control can be unsettling for some. Lastly, the fear of change can also play a role. Surgery often brings changes, whether it's a temporary change in lifestyle during recovery, or a permanent change in physical appearance or function. It's natural to feel apprehensive about these changes. Understanding these fears is the first step towards managing them effectively. It's okay to feel anxious. It's okay to be scared. What's important is that you don't let these fears control you. Recognize them for what they are: natural reactions to a challenging situation. Once you've identified your fears, you can start to address them. You can ask your medical team questions, research reliable sources of information, and speak to people who've gone through similar experiences. The more you know, the less unknown there is to fear. By identifying and understanding your fears, you can begin to manage your anxiety. Now let's explore how you can begin to manage and reduce your anxiety. The first step towards reducing anxiety is understanding. Understanding what? Well, the procedure you're about to undergo. Knowledge is power, and in this case, it's a power that can help ease your worries. Speak to your doctor about the procedure, ask questions, and don't be afraid to voice your fears. Your doctor can provide you with detailed information that can help you feel more prepared and less anxious. Next, let's talk about the power of relaxation techniques. Deep breathing exercises, for instance, can be incredibly helpful in managing anxiety. Just take a deep breath in, hold it for a few seconds, then slowly let it out. As you do this, try to focus your mind on the sensation of your breath. Other techniques include progressive muscle relaxation, where you tense and then relax each muscle group in your body, and guided imagery, where you visualize peaceful and calming scenarios. Then there's the power of positive thinking. Yes, it sounds a bit cliché, but it's effective. Try to shift your thoughts from the negative to the positive. Instead of thinking about what could go wrong, think about what could go right. Visualize the procedure going smoothly and successfully. Remember that thousands of these procedures are performed successfully every day. Another powerful tool at your disposal is distraction. Reading a book, listening to music, watching a movie, or engaging in any other activity that takes your mind off the impending procedure can be surprisingly effective at reducing anxiety. And let's not forget about the importance of maintaining a healthy lifestyle. Regular exercise, a balanced diet, and adequate sleep can all contribute to lower levels of anxiety. You might also find it beneficial to join a support group. Connecting with others who are going through the same experience can provide a sense of camaraderie and understanding that's incredibly comforting. These groups can be found both in person and online, so you can choose the one that best fits your comfort level. Lastly, don't hesitate to seek professional help if your anxiety becomes overwhelming. therapists and counselors are trained to help individuals manage anxiety and can provide you with additional techniques and strategies. Remember, these steps are designed to help you manage your anxiety, not eliminate it completely. It's okay to feel anxious. What's important is that you're taking steps to manage that anxiety and making the process as smooth as possible for yourself. You're stronger than you think, and you're certainly capable of handling this. Just take it one step at a time, and remember, you're not alone in this. There are people ready and willing to help you every step of the way. Having a strong support system is another crucial factor in managing your anxiety. When we talk about support, it's not just about having people around you. It's about having the right people around you, those who understand your fears, listen to your concerns, and stand by you throughout your journey. Imagine you're on a ship in the middle of a storm. The waves are crashing, the wind is howling, and you're all alone. It's terrifying, isn't it? But now, imagine you have a crew with you. They know the storm is scary, but they're there, right beside you, working together to navigate through the tempest. That's what a good support system feels like. Your family and friends are your first line of defense against anxiety. They know you, they love you, and they want the best for you. They can accompany you to hospital visits, help you with daily tasks, or simply be there to lend an ear when you need to vent your worries. But your support system isn't limited to your personal circle. There are numerous support groups out there, both online and offline, where you can connect with people who are going through the same experiences. These communities can offer comfort, advice, and a sense of belonging that can greatly alleviate your anxiety. And let's not forget the critical role of your medical team. From your primary care physician to your anesthesiologist, from your nurses to your physiotherapist, each of them is a part of your support system. They are there not just to provide medical care, but also to offer reassurance, answer your questions, and address your concerns. Their expertise and experience can bring a sense of security and trust that is invaluable in reducing pre-surgery anxiety. In essence, support comes in many forms. It can be a comforting word from a loved one, a helpful tip from a fellow patient, or a reassuring nod from your doctor. Each of these interactions contributes to a network of support that surrounds you, holds you, and helps you navigate through your fears. Remember, you are not alone in this journey. Your support system is there to help you. In conclusion, managing your anxiety before surgery and anesthesia is possible. As we've discussed earlier in this video, the first step towards this goal is to understand your fears. It's completely normal to feel nervous or scared about undergoing surgery and anesthesia. These feelings are often fueled by the unknown or the perception of loss of control. By acknowledging and understanding these fears, you're already making progress towards managing your anxiety. Once you've identified what's causing your anxiety, you can then take proactive steps to reduce it. This might involve educating yourself about the surgery and anesthesia process, or practicing relaxation techniques like deep breathing or visualization. Remember, knowledge is power. The more you know about what's going to happen, the less anxious you'll feel. And relaxation techniques can be a powerful tool to help calm your mind and body. But it's not just about what you can do on your own. Having a strong support system is crucial. This can include your medical team, who can provide valuable information and reassurance, as well as your loved ones, who can offer emotional support. Don't be afraid to lean on these people. They're there to help you through this challenging time. In addition to this, you might also consider seeking help from professionals who specialize in managing pre-surgery anxiety. They can offer additional strategies and resources to help you cope. Remember, everyone's experience with surgery and anesthesia is unique. What works for one person might not work for another. So, it's important to find what works best for you. This might take some trial and error, but it's well worth the effort. Reducing your anxiety before surgery and anesthesia isn't about eliminating fear entirely. It's about managing it in a way that allows you to face your surgery with confidence and peace of mind. Because at the end of the day, that's what really matters. With the right approach and support, you can significantly reduce your anxiety and face your surgery with confidence and peace of mind.